Hi, good morning. This is Andrew Lowsutea, President. Wow, it's so good. Happy New Year. First of all, I wish you all good health and happiness throughout the year. We're so happy that we have a chance to get together again and talk about, how you prevent your three high, get you better health so you don't get your diabetic conversion and will not get diabetic complications. And that is extremely good. I'll share you a story just recently. One of our clients, he came in and saw me, and then he said, "Hey, my blood sugar A1C was about 7 and 8 range." And matter of fact, that he just newly got his sort of diagnosis. Say, "Hey, you are now become a new diabetic person." And with that, he started drinking Lowsutea. And after 3 months, and he was smilingly and came back to me and say, "Andrew, this is so good." I said, "Why?" He said, "My A1C is dropped from 8 all the way down to 5.7. And doctors said, "Wow, you don't need medication anymore, but you have to keep it up. Whatever you do, keep it up." So he was so happy because one, he doesn't have to have medication, which is metformin. Two, his A1C was 5.7. Three, he actually followed our step. Actually did a lot of own control in diet, lower the carbs, exercise, but drink the tea regularly, 6 to 8 cups a day. And plus, it decreases stress. So as this whole, lower his weight and all these totally is really helping him totally decrease his A1C from 8 all the way to 5.7. So he is so happy. Now, I hope all of you can do that because this is really the things that you got to do. And so later we'll talk a little bit about today a very important topic because a lot of people don't realize there's called a type 3C diabetic, which we'll talk about what is a symptom, what is that. Now, this is very different from the type 3 diabetic a lot of people now talk about because that will be actually become an Alzheimer disease because of diabetic. Now, but this type 3C is slightly different. So we talk about a little more later and you better understand. But it is also an issue that you will face if you become a diabetic. And so we will talk more. So let's start our program today. I hope that you will gain a lot of insight what we're doing here. And so from there, you will able to, get yourself really up to speed of what is the disease process of type 3C. Okay, all right. So we will start. Now we all set. Okay. So today our topic is type 3C diabetic with a C, Charlie. Okay. So we talk about the symptom and cause, what it causes, and how to manage it. So this is really important. So we will talk about what it is and what is different between type 1, type 2, and type now 3C, and what kind of cause and symptom, and what's the risk factor, and how to manage, how to treat it, and what is the lifestyle adjustment for your type 3C diabetic, and how can Lowsutea can help you. And that is what we're going to talk about. So today is a really beneficial to all people who have never heard of what is it, type 3C diabetes? Okay, so today you will open your eye now. Now I saw a lot of new people came in today who never actually hear our lectures and there's a lot of new names. There's new customer that comes in and very interested to learn more. So I would like to actually go through the 4 stages of diabetes very quickly. So net result, you all understand what we talk about and help you to better prepare how to not get into diabetes. And on top of that, also help you to basically, even before you become diabetic, you can control all the things we do, like diet and manage your cholesterol, blood pressure. Net result, you really don't move yourself to the stage 3 of the pre-diabetic, eventually convert to diabetes. Now, this is most important that we'll do. Now, first of all, majority of people who have diabetes will go through these 4 stages. The first stage is LDL cholesterol go up. That's the reason why a lot of my clients now, when they have LDL cholesterol go up, they came to see us now. They start drinking Lowsutea, and it brought the LDL cholesterol down to normal level. And that's important, okay? So the reason why is that because the LDL cholesterol will damage the B cells, which is the cell come out from the pancreas to take sugar to the cells. And B cell damage, more B cell come out is not going to work. So more sugar accumulate in the bloodstream. With LDL cholesterol and blood sugar inside the blood vessel, your blood becomes thick and then will start forming plaques everywhere. Now, then very quickly you move to stage 2 because all these plaques, they're going to form on the vessels and go less space on vessels and your blood pressure is start going up. You will start seeing yourself maybe 130, 140, 150. That's why you see a lot of diabetic patients. As we have 3-5 years, they all go up to 140, 150. So net result, this is the result that you will see because of the sugar and the cholesterol, LDL cholesterol mixed together, the blood becomes thick and will start forming plaque. Now, once the plaque form, by the way, it will not disappear. It will continue to be there. So that's why this will be a very detrimental for long-term diabetic patient because they plug everywhere and create a tremendous amount of diabetic complication. Now, you very quickly move down to stage 3, which is called pre-diabetic. And every doctor measure the same thing called HbA1c, shorted called A1c. They will measure the amount of sugar, percent of sugar attached to your hemoglobin. Everybody have hemoglobin. And if you are 5.7 below, you're a normal person. If you're 5.7 above to 6 and 4, you are pre-diabetic. Now, unfortunately, during this stage, it's going to be for a while. And you have no medication. The doctor will say, hey, you know, Mr. So-and-so, you are now pre-diabetic. You have to start watch a diet, do exercise, change lifestyle. And then if not, you become diabetic. Now, unfortunately, majority of people don't understand what that means. So they will continue the same lifestyle. Now, there's one thing can help you is Lowsutea. Can help you to lower your blood sugar, lower your cholesterol, lower your blood pressure, just drinking Lowsutea 6 to 8 cups a day, which maintain your whole body with beta 3 high. Will not now with you have beta 3 high will not give you a better chance to give you the possible conversion and diabetic complication, but still you have to do the lifestyle changes. Very important, meaning you have to exercise, lower your weight, and lower your carbs intake every day at diet. Now, if you don't do anything like that, sorry, the stage 4 will come. Stage 4 is you become a diabetic. Once you convert a diabetic, meaning your A1C will become 6.4%. Then you can't go back. You always stay at 6.4%. And so you don't want to be in that stage of diabetes. So what you got to do is always try to get your blood sugar below 6.4 with A1C. Now, how Lowsutea work? Why I keep saying that Lowsutea? Well, Lowsutea is very simple. There's two things in there. It's not a drug. It's a food. It's a drink. It's a food. There's two things. It's called one, guava leaves, which delay the absorption of sugar entering the blood vessels. And then the second one is bitter melon, which is increase the insulin sensitivity. So it allow more sugar back to the cells. One more unique thing is any excess sugar and also cholesterol and salt will dump out through urine. So net result, your 3 high will decrease because once salt come down, the blood pressure will also come down. So drinking Lowsutea is very important. So that's how it works. Now, we are not here just tell you, oh, well, you know, drink Lowsutea, because really you have to change your lifestyle. And we'll give you a tools. You have drink Lowsutea 6 to 8 cups a day. And then you also take low carb diets, which lower your carbs intakes. So you less carbs absorb into the body system. You have to exercise 8 to 10,000 steps. You have weight control, lower your weight down to 23, BMI 23. So you know you have BMI 30, you got to lower it to 23. And also we have weekly free, this is free webinar, teach you all these concepts. Plus we'll teach you how to daily blood tracking, also your exercise, your weight, all that in the system for you to better understand how to you getting yourself better. Now, the A1C, a lot of time people have 10% of A1C because drinking Lowsutea and working with the exercise, diet, weight control, they drop their A1C back to 5.7. Or if not, they will at least lower than 6.6%. That is wonderful. That's what you're going to be. And that's what we'll try to teach you. And this is why that a lot of people say, wow, that's so exciting. And just like my client with an 8% A1C drop down to 5.7, they are so happy. But I told them, this is not the end game. This is something that you just started. The whole life long, you have to lower your A1C to 5.7. And what we trying to do is help you to change your lifestyle so you can get a habit. Once you get a habit, guess what? You will continue to drive low carb diet and you exercise your weight. If that's the case, your 3 high will continue to be maintained at a normal level, then you will be healthy for many, many years to come. And if not, you'll get your consequences with diabetes. That will be terrible. You don't want to go in that road. Okay. So that's what we'll try to help you to understand. So let's go into what is the type 3C diabetic. I've never heard of that. Okay. Well, that is something that now you're going to hear because type C diabetic is called pancreatic genic diabetic and develop basically after pancreatic disease start going on, either damage the pancreas, like pancreatitis, cystic fibrosis of pancreas, and also pancreatic cancer, or you actually have removed your pancreas. So often this has been misdiagnosed as type 1 or type 2. Approximately 5 to 10% of diabetic patients will have this. So this is something that you need to watch. So now you know what is type 3C now. So really, if you compare type 1, type 2, type 3, let's talk about what that means. Now, type 1 usually because of your autoimmune disease, immune system that attack the insulin production of the beta cell, which damage the beta cell continuously and really have no reason. And though the pancreas, whatever the insulin come out doesn't work. So usually these are people come out with young age, from very young, start off they're type 1 and then go out throughout their life, it's all type 1. Now, which only about 5% of the diabetic will be this type, but 95% will be type 2, which is the insulin have insistent, body produce not enough insulin or cell don't respond to the insulin properly, and really is adult onset, usually is about like 30 and up, all the way down to old age. And more people at older, the more chances to be type 2 diabetic. And that is really the 95% of diabetes. Now, certainly, the third one is type 3C now. Type 3C is that the pancreas is damaged. And then because it's damaged, then insulins are not able to produce enough. And then the amount of insulin to the body not making enough, so the sugar cannot take back to the cells. And I will explain more what kind of damage does that mean. So 1, 2, and 3, usually the majority of us will be type 2. But don't forget, 5% or 10%, this potential type 2 diabetic patient will become type 3C. Okay, so this is something that you need to watch. Now, so the cause of type 3C diabetic will be pancreatitis. In other words, the pancreas got inflamed, and then this is equivalent 20 to 80% of people have chronic inflammation of the pancreas, and that result, they develop type 3C, okay? Now, cystic fibrosis, meaning that the pancreas could be a genetic condition caused, some people have lung cystic fibrosis or in the other organ. And then when they get older, the pancreas also become, fibrotic, with a cystic fibrosis symptom in the pancreas. So they damage the pancreas, it will not cover with B cells. Now, also 50% of the patient also have pancreatic cancer. Now, that can be a quite big majority of people also get that. The cancer developed and it damaged them with damaged pancreas, then the type 3C of diabetic will occur. Now, hemochromatosis, excess buildup iron in the pancreas, then it damage the pancreas. And so net result that now, matter of fact, one of the patient call me and say, hey, my iron is very high. Now, these are the potential guy will come in to get excess pancreas damage the iron. The excess iron will damage the pancreas, and that is something they have to watch. Certainly, some of these people have their pancreas removed, so which is called pancreatectomy. If the pancreas removed, so they have no pancreas, then they have type 3C diabetic. Okay. With that though, what is a symptom? Now, it's commonly, that's why a lot of people misdiagnose, because it look like type 2 diabetic and type 1 diabetic. They have all this symptom. Like they were abdominal pain, increased thirst, dry skin, blurred vision, fatigue, tingling hand and feeling. It's typically just like a diabetes. And they have diarrhea, fatty acid, stool, and constipation, itchy and yeast infection high, unexplained weight loss, numbness, frequent urination, sore that heals slowly. That is very typical of diabetes, and they all have that. Now, the risk factor is if your family has pancreatic disease, chances of you having it is high because it's generic. Also, you have repeated episode of pancreatitis. Now, there's somebody that will always have continued infection, pancreatitis, the infection of pancreas, then you will have that issue. Now, a lot of people don't realize if you drink a lot, alcoholic, large amount of alcohol consumption, you have that too. And then the other one is smoking. If you smoke, also you have chances of that. To find out you whether have type C diabetes, one of the things they look at is your medical history. They will assess your pancreatic disorder, or do you have surgery of pancreatic, or cut part of the pancreas up. All this will be checked. Certain blood tests, which is checking a fasting of glucose, H1C, C-peptide test, or evaluate insulin production. Those they will check on that. Also, they might get a CAT scan, ultrasound, MRI. All these will talk about really what kind of pancreatic damage you have, or do you have a tumor. And also the fecal test, which is stool test, detect any enzyme deficiency. And this is a very typical type C diabetic that you need to think about. Now, then when you know you have this type 3C diabetes, the thing is that it's very similar to control with a type 2 diabetic, meaning you have to control your blood sugar control. Like you drink Lowsutea regularly, 6 to 8 cups a day. And you have to continue to drink so you can lower your blood sugar in the bloodstream. You have the blood sugar level regulate, take steps to keep you within the healthy range, less than 140 milligram per liter per deal, which is like you should continue to do that. And you got to monitor blood sugar level, get a regular A1C. So with that, you follow your diabetic meal plan to stay hydrated, and then you have to reduce the sugar intake and eat healthy. Okay. So in other words, really is almost like a typical diabetic management, because you don't have enough beta cells take sugar into the cells. So you gotta look like treatment just like you are diabetic. Okay. And you have to really adjust on the diet control, which is eating a balanced diet, as low in sugar, processed food, high in fiber, whole grain fruits, vegetable can help you regulate blood sugar level, prevent diabetic, maintain a healthy weight. Very, very typical of a diabetes treatment, right? At least you have 150-minute exercise per week. And then you will basically also do some sort of vigorous, intense exercise. I say we have the barbell going up and down like this. On Stepmaster can work, and you have strength exercise with the barbell like this. 1 pound, 2 pounds is okay. Increase continuously, and at least you could have walk 10,000 steps per day, and 4 times, 5 times a week is good. So these are the things that you gotta do. And on top of that, you have to potentially go for pancreatic enzyme replacement therapy, which is including nutritional absorption. And then if you're a drinker, or you're a heavy drinker, meaning alcohol, and you smoke, you got to quit smoking, because both of them will not going to help you with the type 3C diabetic. Now you have to manage the stress, relax, meditations, time management, leading you a balanced life. You have to write it down, things like that. How can I relax myself, start a hobby, meditation, even to Tai Chi, time with family. All these things will help you to lower your stress. Now, a lot of people lower stress by also watching TV, listening to nice music, reading. That's okay, but you got to figure out what will help you the most to lower the stress. Now, that's why we create Lowsutea with you have to drink 2 liters or at least 1,500 liters of Lowsutea per day. The reason is you have to stay hydrated. If you stay hydrated, you actually make your blood become thinner, not thicker. So net result, plus you have enough volume to excrete all the sugars out. So we are designed to give you 2 liters or 2,000 cc to help you enough hydration to manage all the symptoms and able to have enough liquid to excrete your sugars, cholesterol, and the salt out of your body. So drinking hydration is very important. As you know, a lot of the older folks don't drink enough water. And so they don't have enough water, they don't get the hydration you could require. Now, type C diabetic complication is very similar to the typical diabetes. You have going to have cataract, glaucoma issue, your eye become blur, you have pancreas malfunction, that means you have to add up insulin. More severely is heart disease because they block your coronary artery. You know what? And with damaged coronary artery, you need to get a heart attack. You die, and you don't want to do that. Your nerve damage is also very bad because when you have nerve damage, you're gonna feel. So you have injury you don't know, and you will get gangrene of the foot, and then you're gonna end up amputation, and then it damage your kidney, and you have to get dialysis, damage your blood vessels, and then also risk of stroke and loss of consciousness. All that are very close to a typical diabetes, and you don't want to have that in your shoes on that one. You want to continue to really maintain your regular 3 high, lower blood sugar, so you don't get this kind of complication. Because you get this kind of complication, you will be very, very sick, and then medical costs are extremely high. Plus, you're gonna have really difficulties, to have all kinds of, like people have have to go dialysis every day or every other. If you do CAPD or if you do hemodialysis, have to go hospital 3 times a week. Wow, that is terrible. Don't go on that road, because I manage a lot of people to go to dialysis when I'm working as Vice President Baxter. And you don't want to do that because it is not a good lifestyle. So I hope that you continue to get your 3 high control so you don't fall into this diabetic complication. Now, why Lowsutea really help? Because Lowsutea really definitely help you to lower your blood sugar, your LDL cholesterol, and blood pressure. So your 3 high, if you lower your 3 high, the chances you have getting that earlier complication, it will be much less. So that's what I'm trying to do. And now, so if you lower your blood sugar, lower blood pressure, all of high bad cholesterol basically get back to normal, the chances of you getting complication are less, and that is your objective. So you got to make sure your objective is get yourself into normal blood sugar level. At least make your blood sugar level is normal with A1C 5.7 and below. If you're even at 6, it's better than 8, 9, 10. Okay, so you gotta measure your A1C. Always measure A1C, average 3 months of blood sugar A1C. What does that mean? So if you have A1C 5.7, the chances you have all the complication is very, very minimal. Now, so in conclusion, the type C diabetic is specific for diabetes caused by pancreatic disease or damage by either chronic pancreatic inflammation, which is called pancreatitis, or pancreatic cancer, or pancreas are being removed, which is typically like a type 1, type 2 diabetic symptom will all exhibit. So with that, you will have an issue where you're going to manage yourself as just like a type 2 diabetic. And very important, you have to do that. Lower blood sugar, lower cholesterol, and lower blood pressure. You really need to have a total comprehensive approach for type 3C, because net result, you are no longer have enough insulin. So you might have to inject yourself with insulin for your insulin therapy. And you have the blood sugar control. You have to have pancreatic enzyme replacement for digestions. Tailored diet modification. You have to have regular exercise, stress management, and continue measure your blood sugar level to make sure they are the regular levels stabilized. And plus, you have to have effective management of type C diabetic to improve the quality of life and decrease the risk of complication, meaning that you have to continue to do all the exercise, the blood control, your diet control, your weight control, and better understand all the essence of how to manage a typical type 2 diabetic is very similar. And so you want to do is continue maintain your 3 high levels into normal levels, so decrease the risk of getting diabetic complications. And this is the end of the webinar. I hope you have a good time to understand what we're trying to do. I think I'm very happy that you, all these people in the webinar, listen to a webinar today. Is a very good webinar to get you a better understanding of what we'll do here. And if you actually want to contact us, do write us to Andy, A-N-D-Y, at wahfong.com, A-N-D-Y at WAHFONG.com. And basically this will, there's some question I can always answer you folks. And plus, if you want to WhatsApp us, it's 1-800-388-0903 or 852-6792-8891. That will be something that you will need to continue to check with us on WhatsApp. So that way we can able to get back to you either to WhatsApp or email. I think best is email though, andy@wahfong.com. WhatsApp is okay too. So anyway, try if you have some issue or comments that you want to get to us. So today's lecture will help you to understand there's a really called type 3C diabetes, and give you an alert now there's something, wow, there's something very different to type 2. So that way you can at least understand how to prevent it, watch out for it. And I hope that at the end of the day, after you understand all these concepts, you can protect yourself not to get into big issue like, type 2 diabetic complications. And net result, you have all kind of health issue come by. So I hope that you can understand and continue to help yourself to be healthy, minimize the 3 high above the normal level, so decrease the risk of diabetic complication. I hope you have one wonderful weekend, and I'm looking forward to work with you again next week. Take care. Bye-bye.